Hello, my name is Blessing Wanki, and I'm going to be talking about patient falls. The overview of my community. It is located in Colorado Springs, Colorado, at a long-term care facility called Cheyenne Mountain Care Center. Cheyenne Mountain Care Center is a 159-bed long-term care and skilled nursing facility. The facility is operated under Genesis Healthcare, and Genesis offers over 400 locations across the United States. I will be focusing on the long-term care unit where I worked called Columbine. The community culture. The mission is we improve the lives we touch through the delivery of high-quality healthcare and everyday compassion. Some of the core values are care and compassion for every life we touch, respect and appreciation for each other, teamwork and enjoyment in working together, focus and discipline on improving the quality of care, creativity and innovation to develop effective solutions, honesty and integrity in all dealings. The healthcare workers at this facility work together with the resources provided to them in order to provide quality care for the patients. Religious foundation, the facility encourages activities based on religious doctrine for the residents. Every Saturday, a group from a local church comes in and does some kind of religious activity with the residents, whether it be from Bible study to praise songs to piano playing. The facility implements the spirit of evidence-based practice by constantly updating care plans to meet the needs of our patients. All right, let's talk about the issue. The rates of falls on the long-term care unit keeps going up. A fall is defined as an event in which a person coming to rest unintentionally finds his or herself on the ground floor or lower level. It is an issue because if certain preventative measures are taken, the rate of occurrences will be significantly less and it will help cut costs of emergency room visits by the elderly patients. 81.5% of premature death occurrence in nursing homes is related to a fall. Why does the rate of falls keep going up on this particular unit called Columbine? I feel the fall prevention tool used upon a mission is not detailed enough and the facility has staffing issues. Nurses can only do so much, which is where nursing assistants come into play and can help tremendously in keeping our residents safe. The issue. How has the issue been dealt with in the past? By the facility, the patients who keep falling usually get different implementations added to their plan of care. Exercise, muscle and balance training, and education are often found to be useful in nursing homes for fall prevention for the residents who are cognitively sound. For the cognitively impaired, increased direct supervision is one of the ways other facilities have dealt with this issue. Why is this issue a problem? It is a problem because it can lead to death. Residents' conditions affecting ambulation safety may be more complex and require good clinical assessment. In 2015, the total medical costs for falls totaled more than $50 billion. The average hospital cost for a fall injury is over $30,000. Who has control to solve the problem? Healthcare workers could have some control if they are staffed with enough team workers. Social impact. Fall prevention is essential. However, this endeavor is challenging as there is a lack of compelling evidence that any one intervention will reliably decrease the incidence of falls. This is because many falls have multiple etiologies, requiring consideration of multiple physical, cognitive, and environmental factors. Therefore, reducing the risk of falls and fall-related injuries in long-term care facilities requires a comprehensive approach. Programs available include fall risk screenings. Once a comprehensive fall assessment is completed, the team must plan care interventions to reverse or address each risk identified on the fall assessment instrument or tool. A primary intervention is root cause analysis of patients high risk for falls. Secondary prevention is preventing further injuries when a fall does occur. Analyzing the issue. Some strengths are the nursing staff is able to work together with the staff given to keep the residents safe. After a fall occurs, a thorough assessment is done and the care plan is revised. Physical therapy is available Monday to Friday at this facility, and some residents take advantage of this service to help improve strength and endurance. Some of the weaknesses this facility has is there is a staffing issue. There is usually a shortage of CNAs and it is difficult to keep nursing staff, so the facility has agency nurses come in and out daily. Fall assessment is not done detailedly due to nurses not having enough time and being overworked, so they usually rush it. Most of the residents on this long-term care unit are frail and have many comorbidities, and sometimes it can seem impossible to keep an eye on every single resident. Some ideas to help with the issue. Seeing staff is one of the main issues. The staff should brainstorm ideas on ways to keep staff. Encourage agency nurses to come on as staff or encourage them to come back consistently so some form of continuity of care is happening. Make management aware that an admission nurse is needed. The staff should make initial assessments as priority so as to prevent some of the problems related to the fall from the onset before it happens. The funding will come from the federal government, Medicare, and Medicaid, since that is the most common insurance used by these residents. Recommendation: the nursing home needs a better fall assessment tool that addresses falls. A standardized, thorough fall assessment tool will be used. Individual risk factors will need to be explored because they are the root causes of falls. Many falls have many causes requiring consideration of multiple physical, cognitive, and environmental factors. Therefore, reducing the risk of falls in this long-term care facility requires a comprehensive approach that focuses on identifying the countless conditions that predispose to falls and addressing each resident's identified risk factors. This needs to start on each resident's first day of admission. In addition, when a fall occurs, systematic improvement depends on conducting a thorough root cause analysis of the fall, which includes tracking trends like when, where, and how the fall occurred, the number of falls per unit, and whether any staff member was present. About a month after this is implemented, one should be able to see an improvement in the fall rates from the new residents who were thoroughly assessed. And here are my references. Thank you very much.